Okay, let's go ahead and get started if we can. Elizabeth, can you see media? Can you give them the thumbs up? Are we good to go? Okay. It looks like we have all the committee members here except for one person, and so hopefully they'll join us soon, because we were just kind of chatting. Traffic and travel can always be a bit precarious at best, and so since we have almost everybody here, hopefully that person will join us in a few minutes, and we can get up to speed. I want to cover a few things before we actually kind of get into our work here, if you will. But I'm Gary Tomerlin. I'm the Deputy Assistant Commissioner of Workforce here at the Coordinating Board. And I want to kind of thank all of y'all for agreeing to serve on this committee and agree to tackle this work with us. And what we're going to do today is we're going to begin the process of laying out why we're here, and then that will be a certain amount of a process of us trying to help understand all the factors. And maybe I should say this, we have secondary represented, we have community and technical colleges represented, and then we have business and industry represented on the committee. And so part of our challenge is we've got to learn the lingo that everybody else speaks, because our lingo is slightly different than your lingo and that kind of stuff. And I will tell you that, you know, about all I know about health science is whatever my doctor tells me whenever I go to the doctor's office. And so hopefully after we lay out the roadmap or the foundation, we're going to let y'all get down and let you start speaking health science kind of stuff is our goal here today. But there's a sign-in sheet going around somewhere, and so please make sure you sign in at some point. Probably the most important thing I will tell you, you know, depending on point of view, is this is being webcast. And yes, there are people outside of this room watching this. Maybe I will share that sometimes I tell my wife when I'm in meetings like this of, you know, here's the link to the meeting, and whenever the chair I'm sitting in is empty, I've left and I'm headed home or whatever, but until that chair is empty, I haven't left, you know. But people do watch these things, and they do create public records. And I tell you that more than anything else because it's creating a public record. Anything you say can and will be used against you later. No, I'm sorry, that's the wrong thing. But
can I change chairs?
Well, if you kind of look around, there's cameras from every different angle, and maybe I'll go ahead and skip into my next bullet point on my background information is the microphones. the microphones and the cameras are all actually synced together, and so when you turn your microphone on, a camera will focus in on you. And so, I guess if you don't say anything all day, not that I'm encouraging that, but I'll tell you, I'm going to talk, and so you're going to, but anyway. But the microphones are high gain microphones. You really shouldn't have to move them, other maybe than positioning them up and down a little bit. But when you want to talk, and you get the committee chair's attention and you're recognized, turn your microphone on, and then when you finish, turn it off. And what happens is we get several microphones on at the same time. It starts doing that feedback thing, and that can be very painful for the ears. And also it kind of messes up the tracking system as I discussed. The reason you were selected, there was a nomination process, and it was sent to the secondary schools and the community and technical colleges, and it was sent to business and industry, and you were selected from all those nominations to represent the state of Texas. And so our conversation here today is really and truly a conversation of health science and the state of Texas. I understand that many of you represent colleges and specific companies, but it's really, we need to kind of put on our state of Texas hat, if you will, and that's our operating paradigm, if you will. Wi-Fi, there's unsecured Wi-Fi here in the room if you want to connect your computer, iPad, phone, whatever, and it's education, go get it. And you should just be able to connect to that. It doesn't need a password, and that gives you access to the internet. We have some people in the public out there that we'll point out in a few minutes. And when we go around and we do introductions, but we do have on the agenda a public testimony agenda item, and I tell you that because depending on the work we get into, we may get some kind of public comments or commentary, and so that's a different process. Lunch, I think it was communicated to you via email that we work with a catering company to bring in some sandwiches and stuff, and you were asked to pay $10 to participate in that. We don't have money to buy you lunch, or we would. Rex Peebles, the assistant commissioner, is sitting down back there. He thought about buying lunch, but no. But anyway, so. But so that's just a process we try to make for the committee to help move forward. We do have a little deli or a break room in the front corner of the building if you want to get a bottle of water or soft drink. And there's some sandwiches and a few things like that if you didn't choose to participate in the lunch. But there's an envelope in front of you, and if you'll put your $10 in there, and then I think BJ over here is collecting the money. You have a little expense card laying in front of you, just this little green card. And we have to supply or report to the LBB, the Legislative Budget Board, how much it costs to operate all the various committees that we operate. And so we just use this process to capture the information. And so if you would just fill this out, it doesn't have to be exact. I mean, we really don't care if your airline costs $417.29. If you tell us it was about $400, or estimate your other travel expenses, and then we'll gather those up, and then we just put it all together, and then we submit it when we're required to submit it. The restrooms are in the main hallway, so you can go out these doors over here, or the front doors, in about the middle of the hallway over there. And I already talked about the vending machines. And so I guess I will stop there, and if there are any kind of global questions of anything that I haven't covered, short of the question of why are we here, I'm going to tackle that next. Okay, so why don't we start and do introductions. And Donna, we're going to start with you down there, if that's okay, and then we'll just come around this way. And then I will introduce the people on the second row, and then we'll eventually get them to some microphones.
So my name is Donna Moore, and I'm a registered nurse by profession. I've also hold a secondary teaching certificate for the state of Texas and science education for about 9 years. I'm also a faculty member at Austin Community College and representing higher education as well.
Y'all might need to actually pull that one a little bit. That may go against what I said.
I'm Jan Hooper. I'm representing the Board of Nursing, and I've been a nurse regulator for 14 years, and before that I was a nurse educator for over 20 years.
And I'm Sally Williams. I'm a Workforce Center Director with the Dallas-Fort Worth Hospital Council Foundation. The Dallas-Fort Worth Hospital Council is a trade organization for about 70 acute care hospitals in the North Texas region.
I'm Don Martin. I'm the Associate Dean of Allied Health at El Centro College in Dallas. Also a certified surgical technologist.
Good morning. I'm Helga Carrion, and I am a registered dietitian. I teach nutrition out at El Paso Community College. I'm also coordinator of the Health Professions and Related Sciences program.
I'm Carol Durkowski. I am a registered dental hygienist. I have been with Wharton County Junior College. I'll be starting my 37th year. As faculty, I am also Director of Dental Hygiene and Division Chair of Allied Health.
I'm Sue Ann Lopez. I'm Dean of Health Occupations at South Plains College in Levelland. Most people ask where that is. That's west of Lubbock in the Panhandle. And by trade, I guess you would say I'm a nurse and have been one for 40 years.
I'm Shirley McNeil. I'm with Lamar State College, Port Arthur. I'm the Upper Mobility LVN to ADN Program Coordinator, and I've been with Lamar State College, Port Arthur for 18 years.
Anna Mejia Dichi. I'm an attorney by training, so I'm an odd man out in this room, probably. And I run something called the Healthcare Workforce Alliance of Central Texas, and we're an industry and education partnership that includes community college, universities, hospitals, high schools, and workforce partners here in Central Texas.
And I'm Lou Pelayo. I'm the District Director of Nursing and Allied Health at the Alamo Colleges. There are 5 college locations there, and I have oversight over all of the health programs. I've also been a school nurse in the Edgewood Independent School District, and I've also done some instruction in health occupations courses at the secondary level.
I'm Pamela Rogers, Program Director here at the Texas Higher Education Coordinating Board. And thank you for coming.
I'm Candace Beckham. I'm with Education Service Center Region 12 in Waco, Texas. I'm one of the CTE specialists there who works a lot with our health science technology education teachers in the secondary setting. I've formerly worked as a health science teacher and have also worked as a respiratory therapist.
Hello, I'm Lori Mosley. I'm from Hill College. I've been a nurse for 36 years. I have been working at Hill College for 19 years in various capacities. The last 6 years has been as Dean of Health Sciences.
Good morning, I'm Michelle Trubenstein. I'm a respiratory therapist by trade also, but I am a Dean of Workforce. No, I used to be Dean of Workforce. I'm Dean of Health Professions for the San Angelo site of Howard College.
Good morning, I'm Wanda Johnston. I spent 20 years as a nuclear medicine technologist. I am now the department chair at Memorial High School in San Antonio, teaching in health science.
Good morning, my name is Abe Johnson. I'm currently Vice President and Provost for the Preston Ridge campus, Collin College, McKinney. Until about this is pretty recent. Before that, for 7 years, I was Health Sciences Dean, and I'm a respiratory therapist by profession over 25 years or something.
Okay, thanks all of y'all. Oh, y'all have the cordless microphone? Okay, go ahead, Rex.
I'm Rex Peebles. I'm the Assistant Commissioner for Academic Quality and Workforce at the Coordinating Board.
I'm Dwayne Hiller, I'm Program Director in Academic Quality and Workforce here at the Coordinating Board.
My name is Elizabeth Steele. I'm also a Program Director here at the Coordinating Board.
Hello, my name is Diane Salazar. I work at the Texas Education Agency, where I serve as the State Director for Career and Technical Education.
Okay, so now everybody knows everybody, and we got that all down, right? Well, and I said this earlier, we really do appreciate everybody agreeing to serve on this committee. I hope from the introductions that you realize that we have a diverse group, lots of different experiences and backgrounds. And I tell you that because we're actually going to be working on health sciences as a whole, not just nursing or a specific curriculum area outside of nursing. But as we follow the agenda, we're going to go ahead and item 3 on your agenda is election of co-chairs. And so what we're going to do is we're going to ask for a co-chair to represent community colleges. And so, you know, you can do this a couple of different ways, and actually maybe 3 different ways. If you're from a community college, you can self-nominate yourself if you would like. Anybody can nominate anybody, so you can look at the person sitting to your left or right and nominate them. And then if we don't get nominations, then we have a process to where we yell, vacate the room or something, and the last person out of the room becomes the co-chair. So anyway, if anybody would like to nominate to serve to represent the community colleges as the co-chair, we'll take nominations now.
I'll nominate myself, Don Martin.
Don, I don't know. It seems to be like a whole lot of people that are. Will somebody second Don? Okay, thank you.
Second that.
Are there any other nominations for our first co-chair? Okay. Everybody in favor of Don serving as co-chair, say aye.
Aye.
Any opposed? You won unanimously, Don. Okay, Don. Well, while we get our second co-chair, if you'd maybe like to come up here and get one of these blanks, the chairs to my left, and bring your name tent also, please. Yeah. Well, I'm not going to explain everything up front. There's got to be a little suspense, and I really haven't even told you what you volunteered for yet. So maybe I shouldn't have said that until I get the other co-chair. But now, if we can have another co-chair or nominations from either our secondary representation or our business and industry representation. And maybe I should do a little bit more background work here. We're not really going to ask you to work per se. All we really want you to do is we want y'all to lead the conversations. We will actually help to support and do the lion's share of the work on this. But after we do a certain amount of introductory and why we're here and that kind of stuff, as I've already alluded, we really want to get out of the way and let y'all do the talking because you're the experts, not us. And so with that, a little bit of further explanation that I didn't give Don. Any of the non-community college folks want to either nominate somebody, and of course this is a good opportunity for the community college folks to nominate somebody as well. Any nominations for our other co-chair? We have to do that run thing, Rex.
I self-nominate myself.
I second.
Wanda Johnston.
Any other nominations? Okay. All in favor of Wanda serving as our other co-chair?
Aye.
Aye. Anybody opposed? Okay, I think you won unanimously. Maybe we'll just put numbers under the chairs next time or something
There
like
you
that. But Wanda, if you would, if you'll move over here to the center. And Helga, if you would move up here. And what we're going to do is we're going to leave these couple of chairs because Rex will probably have some comments and/or some of our other staff, and we'll probably let Diane make some comments, and so that frees up a couple of microphones. And what I'm going to do now is I'm going to continue to go through a few items on the agenda, and then we will turn it over to our co-chairs. But what Pam's going to do now is she's going to ask you to reach into the Easter basket here and draw a piece of paper, and you're drawing term lengths. And I will tell you by rule, this committee is established for a term of 4 years. That's based on statute. And we're drawing for 2s and 3s, right, Pam? 2s and 3s. And we're not real sure exactly how long y'all will need to work as a committee. And so what that does is it gives us a way for members to opt off, or not opt off, but rotate off of the committee and others come on, as opposed to just having a date and we have no continuity and no continuation. And so, and I think you just put your name on the piece of paper and then pass it back to Pam, or Pam will come back around and pick it up. And so that will take care of that process fairly quickly. And maybe we should have put a ticket in here that says you get to buy everybody lunch. Okay, everybody has one? Okay, now, so that gets us through that part, and I would turn it over to the chairs, but what I'm going to do is I'm going to continue to kind of take us down the next 2 or 3 agenda items, which talk about the committee charge and some background information. And then the chairs, I'm going to turn it over to y'all on item number 8, if that's okay. And what I'm going to do now is I'm going to take the public testimony, item 6, take that out of order a little bit. Diane, if you'd like to come up to the microphone, and Janice, maybe if you have any comments, we'll go to you first, maybe. And Rex, do you? Not yet? Okay.
Good morning. As I mentioned, I work as the State Director for Career and Technical Education at the Texas Education Agency, where we oversee the secondary side of career and technical education. Myself and a staff of 4 do that. One of the things that we oversee is the Perkins Grant, and our state receives about $92 million. And of that, 85% of that goes to the sub-grantees, the technical colleges and the secondary schools. But one of the things that's required under the Perkins Grant is that the sub-grantees offer a program of study. And so on the secondary side, we have had our programs of study in place for quite some time, especially the secondary side. And I'm just really excited that the post-secondary side is now going to be aligned with the secondary side, and so just really excited about that. We have about 197,000 secondary students that are in the health science career cluster, and it's really growing every year. So anyway, excited to be here. Good luck with your work. Thank you.
Thanks, Diane. And y'all, especially the business and industry folks, you know, like Diane just talked about Perkins, technically it's the Carl D. Perkins Act, and the Carl D. Perkins Career and Technical Education Act, I think is actually its legal name. And as she said, it pumps about $90-some-odd million into the state, and then TEA and the coordinating board are the the money flows through those agencies out to the colleges. But I tell really more of the business and industry folks of, as we get into educational speak and gobbledygook, raise your hand as appropriate. We actually started another committee very similar to this last week around architecture and construction, and one of the business and industry folks said, "Do you have a glossary?" And so we actually have provided you a glossary of some terms today that hopefully will. Are you from Del Mar? You're right up here on the front row. We saved you a seat, but we. Provided a glossary. And so, part of this is we have to understand each other's jargon as we go forward. So I really encourage you to raise your hands as appropriate. And before I go into our PowerPoint presentation, is it Evangeline? Is that correct? If you would like to introduce yourself and explain why you were late. No. Well, then tardiness is okay then.
Yes, I'm so sorry. I guess I underestimated the Austin traffic. So anyway, I drove in from Corpus Christi. My name is Dr. Evangeline De Leon. I'm the chair of the Department of Nurse Education at Del Mar College. So thank you.
Thank you for joining us. And even those of us that live in Austin, I think we often underestimate Austin traffic.
Thank you.
We're glad you're here. And we've just been going over kind of the background, and we're just really getting down to the work and the charge and why we're here. And so you got here at the perfect time. And you have this PowerPoint presentation in your packet. Looks like it's just loose. And I'm just going to kind of go through it. I'm really not going to read all of this to you by any means. But what I want to really try to help you do is understand why we're here and our purpose and the mission, the charge that you're going to be asked to tackle. These bullet points are out of the Texas there's the governor's office has what's known as the Texas Workforce Investment Council. We call it TWIC. But TWIC develops the state strategic workforce plan, and as you can see, they recently did that, and the plan runs for fiscal year 2016 through fiscal year 2023. And you can kind of see the bullet points on here. I kind of want to point out more of the bullet points number 3 and 4. Of use national industry certifications where appropriate as an education or training outcome to connect graduate competencies to job skill requirements. And then the fourth one is align career and technical education program content and outcomes where appropriate. And so that's part of our conversation is aligning of the programs of the various programs between certifications, licensure, that kind of stuff, and that's what you will be tasked with. The TWIC, I can't talk, the Workforce Strategic Plan aligns with WIOA, the Workforce Investment Opportunity Act, and if our TV will ever work up here, but the second bullet point here, I think, really talks about career pathway models, attainment of industry-recognized certificate credentials, in-demand occupations. And I think all of us know right now there's a whole lot of national literature about these middle skill jobs, and business and industry is saying we can't get the qualified workers we need to hire. We're trying to get more students through the pipeline. We've got to increase graduation rates. Maybe this is a good time for me to point out the little logo in the bottom corner of the PowerPoint presentation, 60 by 30 TX. That is, that logo encapsulates the title of the coordinating board's higher education strategic plan, in that 60% of the graduates in the 25 to 34-year-old age group will have a certificate, an associate degree, a bachelor's degree, or a master's by 2030. And so, again, more focus on we've got to get more students qualified to drive the economy forward. And I will tell you that there's probably the most significant part about that plan is the year 2030, because that's pretty much my plan of when I'm going to retire. Y'all understand, right? You know, there's vested interest in that the economy of the state of Texas needs to be robust at that time so that I can retire as I'm planning. And so that's why it's important that we do this work today. Okay, specifically, House Bill 2628 was passed last legislative session, and this is in your packet. I think the second page past your agenda is the actual statute. Well, after our all of your contact information is the statute. I'm not going to read the statute to you, but it's paraphrased, and it says that the coordinating board, with the assistance of institutions of higher education, career and technical education experts, and others, establish programs of study. Well, and that's why we're here today. Okay, so in essence, this is the beginning of the implementation of House Bill 2628 from the last session. And it's statute, Texas Education Code 61.8235. Just in case you have nothing to do, and for the lawyers in the room, so the bill was signed by the governor about this time last year. And so from the time it was signed by the governor into now, we've been doing the prep work to get us to this point today. And so what we have to do as a state agency, there's statute and it's government code, and it says that if we get together a work group, a task force, or anything, it's a committee. And so all of our committees have to have rules that govern the committees, and it tells the committee what their job is. And I mentioned earlier that by statute, the committee exists for 4 years. And so all of this is laid out. And so that's what we've gone through the process of doing, is we laid out all of the rules for the committees. We structured these under career clusters. All the educators in the room probably have a level of awareness of the career clusters. I have a couple of slides in a minute about career clusters, but you are serving for our board. Okay, all of you, we went through a nomination process. The board approved the rules for the committee, and then they approved the nominations, all of you, to serve on this committee, and that gets us to this point. And then I mentioned that we did this last week with architecture and construction, and now we're here today starting this group. There's the career cluster framework. And perhaps business and industry, if you don't have a knowledge of the National Career Cluster Framework, what the model does is it packages or encapsulates all jobs and careers into 16 large career clusters. And so today we're talking about health sciences, and so all the jobs specific to the health sciences are in the health science career cluster. Diane mentioned Achieve Texas earlier, and she talked about the program of study work they've done through Achieve Texas, and I think they have 125 programs of study. Maybe it is 122. I don't remember it is. It says 122 for Achieve Texas. But the career cluster is the whole thing. A career pathway begins to get you more specialized, and then down to a program of study which is more job specific. Or career specific, I guess I should say. We have a graphic in this PowerPoint presentation, and I'll spend a little bit of time on it in a minute. But maybe from a student point of view, if you think of the 16 career clusters as a forest, and if you think about the health science career cluster as a tree, and then you pick another one, transportation, distribution, and logistics, well, once you begin exploring curriculum, taking courses, and that kind of stuff in health science, if you want to go into transportation, distribution, and logistics, there's not a whole lot of transference there. But then I use the forest analogy because, you know, we see the trees up here, right? But then I think we need to think about the roots of the tree, and especially in my forest analogy, because that's where I think the public school sector is. And we all do this. We see a little 3-year-old or a 5-year-old niece or nephew or whatever it is, and we pat them on the head and we say, what do you want to do when you grow up? And whatever their answer is, we say, well, you need to go to college, right? well, what we really probably need to do is start giving a little bit more guidance to those 3 and 5-year-olds. But, you know, we don't want to put too much pressure on them. But anyway, so as students begin working through perhaps even their elementary experience, they begin to do career exploration into middle school and into high school, the roots are getting closer and closer to the surface of the tree, right? And then once you start taking 12 hours, 20 hours, whatever the number is, it really doesn't matter in a specific discipline, you know, starting another discipline, you can still change, but it's, you know, it's a different process. It's a different set of courses. And so that's a bit about the career clusters. And like I said, I've got a tree in here in a minute. The committee, specifically what we're going to do here is develop the curricula, the block of courses which progress in content. And so what we're going to start doing, and you can kind of get this from your agenda if you look at it, is this agenda item number 8, establishing of subcommittees. And so what you're going to be tasked to do is to go in and help us develop these programs of study. Now, we don't think we have the expertise here to do sonography as an example, or RadTech, or any number of disciplines. Some of you might have expertise in that background, and quite honestly, I didn't take notes of all of your backgrounds whenever we were going through the introductions, but we think your task is going to be to steer subcommittees composed of more experts, more specific to the various programs of study that we're going to develop. And so this is where we're going. The next to last bullet point on this slide, I've already talked about, you know, business and industry and the other experts that we have here. We have Jan from the Board of Nursing as an ex officio member. We have Diane. And so those of us here in Austin have a role to help support and guide this process. You, the people on this Health Science Committee, will then help guide the subcommittees. And so that's what we're getting into today, and that's where the conversation is headed. Career pathway, knowledge, skills, and ability, more than one program of study. Program of study, you know, is more specific. The second bullet point on here, and this is really more for the community college folks in the room, is, and some of you probably have a level of awareness of this, but in some of our large metropolitan areas, we have several different community colleges supplying the same employers, and they have nursing programs as an example, and students can't transfer from this program to that program without losing credits, having to start over. And employers are looking at the student applicants, and they all have different credentials, different transcripts, and the employers are trying to figure out which is best qualified. I can go in and tell specific examples, but I won't, of where some of our larger districts comprised of multiple campuses, students can't move from this side of town to that side of town without losing hours and having to resequence and start over and some of that kind of stuff. And then there's just numerous stories of students who started here, and then when they try to transfer there, it's like, well, you took the 3-hour version of that course, we require the 4-hour version of that course. And so that's a lot of the conversation we're going to get into. And again, y'all are the experts, not us, so we're not going to make those recommendations. That's why we have you here. There's my tree, and it shows up better over here. And of course, you have this printed out. But what the tree is trying to convey, like notice we have dual credit at the bottom of the slide. And, you know, I think this is supposed to be a big, majestic oak tree. I'm not 100% sure if it's an oak tree or not. But where do the roots of the tree actually end, and where does the tree actually start? I know just about as much about plants and that kind of stuff as I do health science. Maybe a horticulturalist or whatever could tell me specifically where that is, but I don't know. But the reason we have dual credit there is that I think there is a certain amount of graying of where does it stop and where does it start. And then an oak tree, as an example, has a large trunk before it begins to branch, right? So maybe some disciplines have a lot in commonality, to where maybe you could have a big core of courses, maybe the first year experience, if you will, as an example. But then maybe some career clusters are more like a pine tree, where, you know, I know as a pine tree gets large, it can have a very large trunk, right? But it doesn't really have a defined trunk like an oak tree, I don't think. It's more straight up with branches, right? In my mind, at least, from my point of view, what I think I understand about health sciences, I think health sciences is more like a pine tree, because you have perhaps some commonality, you know, maybe medical terminology as an example, and I'm getting on thin ice here because, you know, my background is computer science. But then as you go into the various disciplines, you know, maybe there is some overlap between rad tech and sonography as an example. And, you know, I mean, I don't know. This is y'all's conversation. But if you want to be a medical doctor, that's a different pathway. And so part of this is understanding of where we're going. And as I said, medical doctor, I need to tell you about another process we're working on. That's called fields of study. Fields of study tackle the academic pathway. The community college 2-year curriculum transferring into a bachelor's degree. And as an example, I talked about last week, we started architecture and construction. Well, if you want to be an architect, that pathway, you can start at a community college, but then you have to go into an architecture program at a university, and many of those programs now are built around a master's degree. So it's really like a 5-year program, right? Could somebody do a year's worth of architecture and then go learn the construction trades and be a builder? The answer is yes. If a builder wants to be an architect, they might be able to do prior learning assessment or a few things like that to accelerate that pathway. But being an architect and being a construction person, there's, you know, especially the trades, there's different kind of things. And so while y'all are working on programs of study, we're also working on fields of study as well. And nursing is a perfect example of a conversation of exactly what does that look like. And you know, I'm going to tell you, I don't 100% know the answer right now, but that'll be a conversation at some time in the future of what does nursing look like. And just to make sure we know definitions, an associate degree nursing program is terminal. You know, you leave there and you're an RN, right? If you want, you can, after you've done that, you can go into a completion program, right? A BSN completion program. There are not a whole lot of nursing programs that fit the definition, when I say a whole lot, I don't know of any, that are designed for you to start at a community college and do 2 years and then transfer to a university and graduate, right? I mean, that would be a field of study. And so I'm kind of laying that out, that I'm running away from it because that might be a conversation that y'all get into, but not me. I'm just really trying to build two definitions of what is a program of study and what is a field of study. Programs of study are more from the high school alignment piece, Diane spoke of this, to the community college piece. Programs of study are more academic in nature, and that, maybe I shouldn't say academic in nature, but when I say academic, I'm thinking of the ACGM, which is the Academic Course Guide Manual for Business and Industry. Those are the academic transfer courses that are in common between community colleges and universities. And anybody is welcome to stop me and call me on any phrase, jargon, any time you want. We have to build that trust with each other because we have 3 separate groups here, plus us as bureaucrats. WECM, this is our inventory of courses. It's the Workforce Education Course Manual, and we call it WECM. We like to give everything acronyms. And this is all of the course inventory of all the technical programs at the community colleges in the state of Texas. In this couple of bullet points, about WECM. It was established, it was a field-driven process. It's been in place about 20 years. Dwayne Hiller on the second row back there supports. He's really the keeper of everything WECM. Everybody knows Dwayne. We still have a WECM course review process, and we will continue to have a course review process. This process is not just go in and review the WECM courses and say, let's pick out these 12 or these 15 or anything like this. This is really and truly more about trying to figure out what do students need to know, what is the sequence, and then, I gave you the statute. There's a, I think it's G in the statute, and it says that if a student is enrolled in a board-approved program of study, so once y'all have done some work, and other committees we're working with, once they've done some work, and you come up and say, hey, this is the blueprint for this, whatever discipline it is, those will be submitted to the board, and I would assume the board will approve those, but that's kind of a board decision, not my decision. And once the board approves them, those become state-approved programs of study. And then statute says that if a student is enrolled at a community college in a state-approved program of study, and then they transfer to your college and they're 75% done, you have to find a way that they're also 75% done at your college. And so it's really about easing the pathway for students. And I mean, maybe that is like, well, my program's different, but hopefully it's really about helping students, helping meet the needs of the economy, helping it so I can retire. All of those kind of things is really and truly our purpose here. And Rex and I were in a conversation with another person upstairs this morning. We're talking about another issue, and I don't know how many times it was said, but it's like, okay, we really have to focus on what are the outcomes, how do we help students? And, that's really and truly our jobs here at this agency, not saying that your jobs don't do that as well, but we look at students at the state level. Little sidebar, I have two boys, one is 21 and one's 23, and I tell them, I go, I get paid to make decisions for 725,000 and two students. The 725,000 are the ones that are enrolled in community and technical colleges in the state. I don't know a whole lot about personal detail about them. And then the two is the two of them. And then I tell them, the state pays me well to do it for all of those, and I'll do it for y'all for free. And of course we know that you serve students as well, but it's really just kind of how can we improve student success and how can we help students in the state of Texas. We've made some resources available to you. This is a team effort on putting this graphic together. And I mean, the animation, I just probably have to run through this 2 or 3 times, but really and truly, it's a tri-agency initiative. Us, the coordinating board, Diane, and others from TEA, the Texas Education Agency, and then the Texas Workforce Commission is also involved in this initiative. And I think this really shows the pipeline, if you will, from a state agency point of view. Texas Workforce Commission, they really and truly want people to get jobs, and they want employers to come to Texas to grow the Texas economy and that kind of stuff. We, the two education agencies, we want student success. We know that students need credentials, they need associate degrees to supply and drive the economy. And so that's kind of what this is trying to represent. Diane mentioned Achieve Texas. This is a project that was, Diane, when did y'all first fund this? 2010-ish, 2009? Oh, okay. Before I came here, I represented the community college side. There was a TX Career Clusters project that was funded by the coordinating board. I was involved in that starting in about 2010 myself. But this was a field-driven process, and what has happened since that process, I mean, that process still exists. Are y'all still funding Achieve Texas? That still exists, and Karen Alexander did a lot of this work out of Texas Tech, but what we're now doing is taking that the next level because we're working off of a directive from statute, and that's why we're here. You can, we've given you some tools here, and this is kind of from education speak point of view, but there's the Perkins Collaborative Resource Network, and they have resources out there, and SIP codes, and business and industry, this is where we get into some education speak, but we're going to try to get out of this fairly quickly. SIP codes, classification of instructional programs, all the health, well, maybe I shouldn't say all, but the vast majority of the health science disciplines are, the health science career cluster are in SIP code 51. There are some things that are in a couple other SIP codes, but we're probably not going to look at those as this committee because they're academic. ONET codes and SOC codes are standard occupation codes, or more from the Texas Workforce Commission, and they're more job specific. And so our business and industry probably knows SOC codes, but collectively all of us have to kind of get through all this gobbledygook to understand what we're talking about. But we have some various resources in your packet that I'll go through next, and we'll talk about a little bit. These websites I've already talked about. Achieve Texas, Advanced CTE is another Texas site, Association for Career and Technical Education, the National Skills Coalition. I mentioned the Perkins Crosswalk. Our website, txhighereddata.org, we have lots of information about graduation, student enrollments, that kind of stuff. We've given you some of that as a starting point. I talked about the WACM course manual. And then the last link up there is the Guideline for Instructional Programs on Workforce Education, or what we call as GIPWE. And there's going to be a test on all this in a little bit. But collectively, as we work over the coming period of time this group works, these will probably be useful tools, and they all provide a level of information. Pam, can you tell me where the glossary is?
It should be in our packet.
Is it in the Staples?
It's at the last couple of pages of the packet.
Okay, so the last 3 or 4 pages out of your packet is the glossary, and this is out of GIPWE, and we actually added a couple of definitions to it. But this it's just information to help level the playing field. We're not expecting mastery, but we are trying to get to a level that we can all have the same conversation and understand each other. Jan.
I think there's one other resource that might be helpful, and that's, many of you know about the cabinet model that was developed by a lot of nursing programs in the state to develop an articulation for associate degree with baccalaureate, and then try to set agreements between those schools. So I think that's a model we need to consider also.
Are those resources on the Board of Nursing website, or do we have them on our site?
I don't think they're on our website. They have their own website, but that work was done as a part of the Texas Team Action Coalition and the Texas Nurses Foundation for a number of years, and some of you may have been in that work group. I don't know. Okay, so.
Okay, well, we can find that, and as our meetings go forward, we can share others, and we can talk about others, and of course, as we pointed out, we have quite a few staff members down here, so we can go up and print as appropriate and that kind of stuff, and make more stuff available if needed. And quite honestly, we had a meeting yesterday afternoon, fairly late in the day, trying to figure out what all to give y'all without totally overwhelming you, but then giving you enough resources to go to work. And so if you want more stuff, we'll be glad to find it for you. Oh, okay, I'll get that in a second. Pam's here to tell me when I mess up, but anyway, so there's contact information for me and Pam. Pam will be your primary support, but I'm available as well. Pam will do the lion's share of work on working with our co-chairs on really organizing meetings and communicating with the group and disseminating information and all of that kind of stuff. And I've kind of alluded to this, but maybe I should share with you that whenever Pam joined us back in March, and I was describing the process with her of what her job would be, I told her that she'd either be planning a meeting, hosting a meeting, or wrapping up from a meeting. And the last 3 weeks, I think we did the architecture field study meeting. I talked about field study 3 weeks ago from either Tuesday or Wednesday. We did architecture and construction last week, and then we're doing this one this week. Then we have to start getting minutes out and scheduling next meeting and that kind of stuff. But we have Pam and we have Elizabeth and others who are supporting this effort. And well, I tell you all that because I don't know exactly what scale we can bring all this to, but we are working on it, and we appreciate you going along this process with us. I will tell you there's a little bit of we're building this airplane as we're flying it. So, we ask you to maybe hang in there with us. I told you that this legislation was passed about this time last year, and we've got the committees up and running now. Many of you probably know we did the nomination process sometime in, I think it was late February or March. We had to take those to our board in April. Then we had to once we got their approval, then we had to schedule the meeting. And so every process we do takes a certain amount of time. And so while it has been a year, getting it up and running after a year, we've moving fairly quickly. We might be able to improve the schedule as we move forward. But if you think we're deficient or remiss in anything that we communicate to you, if you don't feel like you have direction, you don't understand what we're trying to do, talk to us. And as I told you, last week we didn't give a glossary. This week we're giving you all a glossary because a person asked for it last week. We didn't think, because we know all the terms, and so you don't think about these kind of things. But Pam pointed out to me that I didn't get a recording secretary. And what we normally look for here is if there's one of you that just takes copious notes and writes everything down, maybe you could consider nominating yourself. But as I said, the meeting is being recorded, and we have audio of the meeting. We go back and listen to that, and we work to help pull the minutes together. But we don't understand the health science language. We don't understand the jargon. And so that's why we kind of ask somebody that really understands this, because if y'all throw out an acronym and, we have to try to understand it, we might get NSFA or whatever, and y'all may know what that is, but, I probably just made up the acronym for something, who knows what I made up. But, if we can go back to that item, and I'll ask for nominations for somebody to assist in that process. Y'all are just a volunteering group. Have y'all heard the new word they're going to put in Webster's? It's called voluntoed. Anybody willing to take that on? I was just fixing to say you can volunteer the person sitting directly in front of you. I can't see your name from here.
Oh, Sue Ann Lopez.
Sue Ann. Sue Ann has graciously nominated herself. Will somebody second that?
I'll second.
Anybody else want to nominate themselves or somebody else? Okay. All in favor of Sue Ann serving as our recording secretary?
Aye.
Anybody opposed? Okay. So with that said, that kind of gets us through the first part of our agenda, and I kind of thought it would take us an hour, and we're right about an hour into it. So I'll stop there and pause for a minute. And does anybody have any questions? And Rex is coming. You want to talk now, or you want to do questions first?
No, I'll go ahead. So I told you I was saving this up. So I just wanted to make two comments about some of the things that Gary said. And he made the comment about the program study being a secondary to post-secondary pathway, but it's also a two-year school to two-year school pathway as well. And I'll give you the anecdote I give everybody else about what prompted my own interest in this. So when I was the vice president for instruction at Midland College for a while, I had the dubious honor of serving as the acting dean for health sciences for 6 months. And due to a lot of issues that I won't get into, but so I learned more about the health sciences than I ever wanted to know. And I've always thought that the only jargon that ever mattered in health sciences was, this is only going to sting a little bit, which was completely false and mostly just a blatant lie whenever they said this is, I remember the guy who set my ankle and he said, this is only going to hurt a little bit. And then he gave me a tongue depressor to put in my mouth. And I thought, I don't think this is going to hurt just a little bit. And then he told my father to get up and hold my shoulders down while he set my ankle so that I wouldn't rise up and hit him, as it came across. So anyway, and he prefaced all this by saying, oh, it's just going to hurt a little bit. So I always thought that's the only jargon that you ever really needed to know about. But during my tenure as Dean of Health Sciences, I advised two students, one who came to me and said, I would like to transfer from the Odessa College program to the Midland College program. And she had done 1 year of an associate degree nursing. And so I looked at their program and I looked at our program. And for those of you familiar with West Texas, and you know that Odessa and Midland, it's about 18 miles from downtown to downtown. So you could refer to them as twin cities, but they have never gotten along the way any twins have ever gotten along. So you can't really call them that. But be that as it may, the best advice I could give her was to finish at Odessa, because if she came to Midland, she was going to have to virtually start over in her program. And then I advised another student who wanted to go from Midland College to Houston Community College, or, Midland's in the middle of the oil fields out there. And so her husband worked in the oil industry and he got transferred from Midland to Houston. And for some strange reason, she wanted to move with him. Or as it turned out, though, I think in the end, she got the best, because I think she stayed in Midland and he went to Houston and took the kids with him. So she had like a year-long vacation then, which I always thought was kind of neat for her. But I looked at Midland's program and I looked at Houston Community College's program, and she too had finished about a year, so she still had another year to go. And I looked at those two programs and I said, you really should check with Houston Community College to verify what I'm about to tell you. But it appears to me that the best thing you can do is stay in Midland and finish, because if you go to Houston, you're going to have to start all over again, basically. And it really struck me, because associate degree nursing programs have the same endpoint, and that is to get students to pass NCLEX so they can become registered nurses and go to work, and then be licensed by the state of Texas to go to work. And the curriculum is very similar in the sense that a lot of this is given to you by the DECs, and that, if I remember correctly, that's what those things are called, right? And so there should be enormous similarity in nursing programs, and indeed there is, but the way the courses are structured and the sequencing of those courses and everything else is all over the map. And so, there are 50 community colleges in Texas, and there are about 50 different versions to do this, and sometimes there are more because there are, schools within the colleges that have their own versions. As Gary pointed out, sometimes it's hard to go across town with some of this stuff. And so, part of what piqued my interest in this was that whole scenario of, this is sort of crazy, that you have a situation where there should be a lot of similarity in not only in the content of those programs, but also in the structure of those programs. And, there was a time when transfer students among particularly workforce programs, the tendency really was that they usually finished wherever they started, because you had 1-year certificates, 2-year AAS degrees, and so it was kind of uncommon for students to actually transfer out in those days. But just as in the 2 to 4 year side of things, where transfers become more and more common, between, 2 to 4 and 4 to 2 and 2 to 2 and 4 to 4 and 2 to 4 to 4 to 2 and back